Uh, Good evening, good evening, ladies and gentlemen, and I welcome you all for this show, whereby we'll have our insurer, our brokers, Zamara Risk. We have our consultant, risk consultant, Hilda from Zamara, and I would like to invite her to start to introduce herself also, and thereafter she will also introduce the doctor, and from there we'll start the awareness program. She'll introduce the doctor, and I'm anticipating that this presentation is going to be more of information awareness, and later we can also ask few questions to the doctor. Doctor will be in the position of answering those questions, and I hope we will have this agenda of screening our health also after the show, and we'll also understand after the presentation of the doctor. We'll actually understand why we actually require to screen and the importance of it. So, without taking that much of your time, I would like to introduce Hilda from Zamara Risk. Hilda, the stage is yours.
Thank you, Mr. Aliraza. Good evening, members. As you've heard, my name is Hilda Mwirigi. I manage the Africa Federation accounts here at Zamara, and it's a pleasure to have you all on this call today. And I'm glad that we're having this again in October, when we're also having the breast cancer awareness month. So it's a good coincidence that we are having this session today. And I pray and believe that we will all learn and also get knowledge in regards to cancer awareness. And we hope that we're going to have a very interactive session and a very productive session. So without taking much of the time, I'd like to introduce our facilitator for today, who is Dr. Stephanie. Dr. Stephanie is one of our partners, and she'll be taking you through today's session. So welcome, Dr. Stephanie, and looking forward to an interactive session. Thank you.
Thank you for the introduction. Good evening, everyone. I hope everyone is well. I'm also hoping for an interactive session. I hope we'll have enough time to go through the presentation and also answer, if not all, most of the questions. But I'll also be available later on for anyone who will have any questions later. If at any point, due to any technical issues, maybe you don't hear me or you lose me anywhere, please feel free to stop me or ask me to go back. So going straight to today's presentation on cancer awareness. The thing about cancer awareness is we are trying, awareness is crucial for a number of reasons. One, it helps with early detection. So with early detection, it significantly improves treatment outcomes. And when we have the knowledge about how we can prevent cancers, it helps to reduce cancer incidence. It also helps us to give support because cancer affects us either directly or indirectly. Maybe we know someone who has had cancer or a family member, even though he might not have suffered from it. And it also helps to reduce the stigma that surrounds cancer. So I put this picture here because a healthy tree, or rather for a tree to be healthy, it is sustained by good nutrition, and it gets its nutrition from the soil. Similarly, for us to sustain a healthy body, we need to fill our bodies with healthy substances. So when you are physically inactive, when you consume alcohol or tobacco or unhealthy diet, it has consequences on our physical bodies. and some of the diseases it predisposes us to, not just cancer. We're talking about diabetes, heart disease and stroke, chronic lung diseases, and other non-communicable diseases. So you'll be able to go through what cancer is. We'll discuss about the global cancer burden. And then because there are very, very many different cancers, we'll focus on the most common ones, being breast cancer and cervical cancer, especially among the ladies, and prostate cancer and colon cancer, and touch a bit also on stomach cancer. And our main focus will be on screening, because that, apart from the knowledge, will help us with prevention. So when you're talking about cancer, we are talking about, we're referring to normal healthy tissue that has undergone some changes, and it has transformed from non-cancerous to precancerous and eventually being cancerous. And the thing about these cancerous cells is they have the ability to grow abnormally, and then these cells can grow, or these tissues can grow to even nearby body parts. So on the cancer burden, so the incidences or the cases of cancer have been on the rise globally, with an estimated of 20 million new cases and 9.7 million deaths in 2002. This is according to the Global Cancer Awareness of 2002. With the most common cancers being breast cancer, lung cancer, colon cancer, rectal, prostate, stomach, and cervical. However, lung cancer has the highest mortality. So there are those common risk factors that can predispose us to cancer. And some risk factors are specific to certain cancers. So in general, they can either be divided into modifiable and non-modifiable risk factors, or they can also be divided into behavioral risk factors, biological, environmental, and genetic. So when you're talking about behavioral risk factors, it's what we do. For example, tobacco use, harmful use of alcohol, unhealthy diet, or physical inactivity. All this predisposing us to cancer. Then we have biologic risk factors. Biological risk factors are those risk factors about us that are about our biology, our physical features. So being overweight or obesity, age and sex, some of which, age and sex being those biological risk factors that we cannot change. Environmental risk factors, this can be from carcinogens in the environment. There's a lot of pollution, maybe from industries, from fumes, from smoke, and certain viruses like hepatitis B and C, bacteria, parasites. And then we have genetic risk factors, where specific individuals are predisposed to certain cancers because they have that gene that predisposes them to a specific cancer. The genes that predispose people to breast cancer, prostate cancer, and so on. So I like to ask the question, when you're talking about cancer, what self-care means to different people, either ladies or gentlemen. For some people, self-care is going to the salon to make their hair or to make their nails, or spending some time listening to music or reading a book, or whatever it is self-care means to us. And I'd like to tell people that self-care should also include our health. We should be intentional about taking care of our health. So to start off, we'll talk about breast cancer. It is one of the leading cancers in females. And there are some risk factors that predispose us to female cancer. And when I say us, I mean both male and female. The cases are more in female than male, but males can still have breast cancer. So the risk factors include being female, increasing in age, and this is because the older one is, the more chances that they have been exposed to some either form of radiation or form of hormonal exposure to hormones that may predispose one to breast cancer. A personal history of breast conditions. There are some conditions of the breast that can later turn to be cancerous. A personal history of breast cancer, where maybe one had breast cancer on the right breast, then they have a higher chance of getting breast cancer on the left one. There are some genes that predispose individuals to breast cancer, for example, BRCA1 and BRCA2 genes, and radiation exposure. And because of this, even when you're screening, there are certain screening tools that we cannot use in ladies of specific ages because we don't want to put them at risk of developing breast cancer. Other risk factors include things like obesity, starting period at a younger age, or beginning menopause at an older age. And this is because of exposure to the hormones estrogen. So when one starts their period early or menopause late, it means that they have been exposed to estrogen for a longer duration. And estrogen is, high levels of estrogen is one of the risk factors of breast cancer. Having first child at an older age. This is because you are assuming that after pregnancy and childbirth, there'll be breastfeeding, and during breastfeeding, one of the hormones that is produced is prolactin, which helps with milk production. And these prolactin hormones helps to lower the levels of estrogen. Having never been pregnant, postmenopausal hormonal therapy, alcohol consumption. And it is not that one specific risk factor predisposes an individual to breast cancer. It's usually more than one risk factor that has to happen before development of breast cancer. So it doesn't mean that, for example, a lady who has never been pregnant will eventually get breast cancer. As I mentioned, breast cancer can also affect male. And this can happen where we have testicular abnormalities. This is where the male hormone is produced. So when you have either abnormalities of the testicles and they're not able to produce the male hormones, then there is some sort of hormonal imbalance, and they'll tend to have more of less of the male hormones, predisposing them to breast cancer. Other conditions, there are some other medical conditions where male have an extra X chromosome, where there's family history of breast cancer, men who've had some sort of breast disorders, exposure to radiation, old age, and some studies that showed the male of Jewish descent were more predisposed to breast cancer than other men. Breast cancer tends to be more aggressive or to have a poor prognosis than in women. And this may be attributed to the fact that maybe by the time they're showing up to the health facility, they've suffered for so long, or diagnosis is not caught early. So when you're talking about breast cancer awareness and screening, what we want to focus on is prevention. There is the self-breast exam that a lady or a gentleman can do on themselves. For ladies, it can be done once a month, preferably maybe a week after the menstrual periods, because the breasts are not as tender. So it becomes easier to feel for any abnormalities. I don't know how many of us have done a self-breast examination or know what to look out for when doing a self-breast examination. So with the hands behind the head or on the hips, this can be done while standing in front of the mirror. Some say you can do it when you're showering because the skin is more sensitive. But what we need to look out for when you're doing a self-breast exam, you need to look for any abnormal changes on the skin. Is there any form of dimpling or puckering? Any abnormal lumps or thickening on the breast? Any abnormal nipples like inversion, or is it facing a different direction? Is there any nipple discharge? It can be blood or yellowish, any abnormal discharge. Any swellings in the collarbone or in the armpit area. And this is important because breast cancer spreads that way. It can go to the collarbone or in the armpit area. Feeling for any constant pain in the breast or armpits. Any abnormal changes in size. Does one breast look obviously bigger than the other? Any rash or crusting in the nipple or surrounding area. And this is to be done monthly. October is Breast Cancer Awareness Month, but apart from that, it's something that we can do regularly. So we mentioned about feeling for lumps in the breast, nipple inversion or discharge, pain, sores around the nipple area. And when you're talking about any swellings in the armpits, you're talking about enlarged lymph nodes. So breast cancer is highly preventable. And what we use for screening of breast cancer, what is recommended by our guidelines is mammography. And this we do to ladies from the age of 40 years and above. I mentioned earlier that exposure to radiation is one of the risk factors for breast cancer. So to avoid exposing younger ladies to radiation, we do mammography from the age of 40 and above, because from this age, benefits outweigh the risk. So the self-breast examination and clinical breast examination just supplement mammography. But for ladies, when you want to screen ladies in their 20s from around 25 to 39, we do the clinical breast exam and the breast ultrasound as the screening modalities. However, when a lady presents younger than 40 with the symptoms suggestive of breast cancer, and they are high risk high risk for someone who can get breast cancer. Maybe they have a first-degree relative who's had breast cancer, or they are known to have the gene that causes breast cancer. Then in that case, we just proceed to do mammography. So just as a by the way, some of the conventional treatments for breast cancer include surgery, chemotherapy, hormonal therapy, where medication is given to block the estrogen receptors in treatment of breast cancer, and radiation. So when you're talking about breast cancer screening and prevention, the picture there is just showing a lady who is about to have a mammogram. So surveillance is about mammography. We talked about the ultrasound, the clinical breast and self-breast examination. We avoid breast cancer by diet, exercise, what we talked about, behavioral risk factors. Chemo prevention, though I can't mention on how common it is or how it happens, is where medication is given to block estrogen receptors. And there are specific considerations that are done before chemo prevention is done. And there are ladies who opt for prophylactic surgery, where they can opt for bilateral mastectomy. And I think there is a celebrity who opted once for the bilateral mastectomy, or oophorectomy, where the ovaries are removed. Estrogen is produced by the ovaries, so the ladies who opt for oophorectomy. And also for this, I can't comment on how common it is here in Kenya, or generally globally. So knowing about breast cancer is not enough. We also have to take charge to be screened. So we'll move on to cervical cancer. It is primarily caused by the HPV virus, or human papilloma virus, which is a virus that is sexually transmitted. So both male and female carriers has over 100 genotypes. Someone who is sexually active has been exposed to HPV virus at one point, and not all HPV genotypes cause cancer. And sometimes one is infected and they have a strong immunity and they're able to fight the infection. So not all HPV progresses to cancer. So what I want you to keep in mind is that cervical cancer is slow growing. Before it progresses from normal to precancerous to cancerous changes, a lot can happen in terms of prevention, early detection, and treatment. And cervical cancer can be eliminated. So the genotypes of HPV that are known to cause cervical cancer are HPV 16 and 18. We call them the high-risk HPV types. There are other genotypes of HPV that cause other conditions like genital warts. So there are many different others. But the ones that are known that cause cervical cancer, the highest cases of cervical cancer are 16 and 18. I've mentioned HPV is a sexually transmitted infection. And 80% of women can be infected at some point in their life. I've mentioned that infection can also clear naturally for someone who has a strong immunity. I mentioned that HPV progresses slowly, and what steps we can take in terms of prevention, up to the point where we're talking about treatment. Unfortunately, we're having a lot of young people engaging in sexual activity at quite a young age. So that is why with the introduction of the HPV vaccine, it can be given to girls from as young as 9 years. And I'm saying girls because in our country and I think in our continent, we still don't have the financial resources to vaccinate both male and female. In females, the HPV virus causes cervical cancer, but in male, it causes penile cancer, anal cancer, throat cancer, which are not as common. So because of the economic or financial limitations, we are currently vaccinating only girls and from as young as 9 years. In other continents, they are also vaccinating their boys. And apart from the HPV vaccination, as part of prevention, is talking to having a sexual education with the young girls and boys, and also male circumcision. When you're talking about secondary prevention, now we are screening, and screening is currently from age 25 years and above. And screening is done, there are many ways of screening. We have the HPV DNA, and I think what a lot of us know about, we have the pap smear. And you have other screening tools which we use in low-income setups or in areas where we have limited resources. We'll talk about that, I think, in the next slide. And in tertiary prevention is where someone has already been diagnosed with cervical cancer and you're dealing now with more treatment, which options can include surgery, radiochemotherapy, or in very invasive disease, palliative care, just to improve an individual's quality of life. So what are some of the risk factors when it comes to cervical cancer? We mentioned it is a sexually transmitted infection, the HPV virus, that is. So early initiation of sexual intercourse, it means that one has a higher risk of exposure. Having multiple sexual partners, having a sexual partner with multiple sexual partners. When one has co-infection with other sexually transmitted infections, because the cervix becomes inflamed and it becomes easier for the HPV virus to penetrate. Multiparity, or having multiple pregnancies, in the sense that it is presumed that with many pregnancies, one becomes exposed more to the HPV virus, and also the trauma that can happen to the cervix during delivery and the changes that can occur can influence or can cause, make it easier rather for the virus to affect the cervix, to predispose to cervical cancer. And immunosuppression. I mentioned that when the immunity is strong, one can be able to clear the HPV virus, but when there is immunosuppression, it becomes difficult to clear the infection. I mentioned that the target screening population is from 25 years, and the HPV DNA is the recommended screening tool for cervical cancer. However, we also have the HPV DNA is also available in a lot of the health facilities. but maybe what most of us know of is the pap smear, which is cytology, where we look for any abnormal changes in the cervical cells. In resource-limited centers, there are other ways where we screen for cervical cancer. I'm not sure if you're aware of it, but we have what is called VIA VILI. VIA stands for visual inspection with acetic acid, or VILI, which is visual inspection with Lugol's iodine. It is quite common in rural setups here in Kenya. It is just something to know about. So some of the symptoms of cervical cancer include abnormal bleeding. And this bleeding can happen to be bleeding in between menstrual periods, after sexual intercourse, after pelvic exam, or after menopause. Though even in bleeding after menopause, we consider other conditions like endometrial cancer. Vaginal discharge that is abnormal, either in terms of amount, color, consistency, or smell. And when the cancer spreads to the nearby organs, can present with pelvic pain or pelvic urination, painful urination. This is just by the way. Even with invasive cervical cancer, women can still be cured, but it requires prompt management by the healthcare providers. Treatment options for cervical cancer include surgery, radiotherapy, chemotherapy, and they can be used in combination. Of note is that if left untreated, invasive cervical cancer is almost always fatal. So now to touch on prostate cancer. The reason I put this picture here will help us to understand on some of the symptoms that males experience with the development of prostate cancer. So the prostate is very close to the urethra, the passageway for urine. So in prostate cancer, when it enlarges, it blocks this passage, causing the urethra to narrow and blocking urine flow. And then with that, there will be those symptoms of constantly feeling like the bladder is not empty, straining so much for urine to pass through the narrowed urethra. There can be presence of blood in urine and so on. So we'll get to the symptoms. So prostate cancer is predominantly a male cancer because prostate is a male organ. It is not in females. In the picture, I showed you its location, how it surrounds the urethra, and how that explains the symptoms that male experience when the prostate enlarges. So some of the symptoms: frequent urination, because there's that feeling that the bladder is not emptying. So there's that frequent need to pass urine. Weak flow, because the urethra is narrowed. So maybe if someone would pee and it would go far, now it's probably dribbling at the level of the feet. Pain when passing urine, blood in urine. And if it progresses to the nearby organs, if it is the spine, it can present with back pain. If it moves to the colon and causes obstruction, can present with constipation, and so on. So the cause of prostate cancer is not known, but there are some risk factors that predispose men to prostate cancer. So things like smoking, unhealthy diet, physical inactivity, those are some of the things that can predispose men to prostate cancer. And we mentioned them when you're talking about behavioral risk factors. And those behavioral risk factors not only when we don't smoke or maintain a healthy diet, be physically active and maintain a healthy weight, it not only helps to lower the risk of cancers, but it also helps to reduce the risk of heart disease, diabetes, stroke, and so on. So how do we look for prostate cancer, or how do we screen for prostate cancer? So screening for prostate cancer is not routinely done. It's highly individualized, and the decision is made by the client and the caregiver. And this is because one of the ways we screen for prostate cancer is measuring levels of PSA, or what we call prostate-specific antigen. The reason we don't routinely screen is it is not only prostate-specific prostate cancer that causes high levels of PSA in blood. There are other conditions that can cause high levels of PSA. So to avoid overdiagnosing prostate cancer, screening is highly individualized. Some other conditions that can cause elevation of PSA include things like BPH, or benign prostatic hyperplasia, which is not cancer. As men age, levels of PSA tend to go up. It can also happen with infections, like sexually transmitted infections like orchitis and other inflammations of the male genitalia that can cause PSA level to go up. So we test PSA in blood as a screening tool for prostate cancer. Other ways we look for prostate enlargement, because for a diagnosis of cancer to be made, there has to be the biopsy part and the histopathology part to confirm. So another way of screening or feeling for prostate enlargement is the digital rectal examination, where we feel for prostate enlargement by a rectal examination. But nowadays, there are other ways of looking for prostate enlargement, things like a prostate ultrasound to assess for enlargement. So you mentioned how we can prevent prostate cancer by not smoking, maintaining a healthy diet, being physically active, and maintaining a healthy weight. A little bit on stomach cancer before we move to colon cancer. The exact cause of stomach cancer is not known, but there are some risk factors. It tends to be more in male than women, and especially older men are at risk. Tends to be more common in Asian. This is maybe on statistics. Diet, foods that are smoked, salted, or pickled tend to be a risk factor. H. pylori infection, which on clinical practice, we are seeing a lot of cases of H. pylori infection. It increases the risk of stomach cancer, and it usually presents with symptoms like bloating, pain when you eat, smoking. Cigarette smoking is a risk factor for stomach cancer. Some certain health conditions can also predispose to stomach cancer, things like pernicious anemia, where one has low levels of vitamin B12. So there's that constant inflammation in the stomach. And also family history, where families have cases of stomach cancer, then other family members are at a high risk also of developing stomach cancer. So initial symptoms are nonspecific. It can present with discomfort around the stomach, bloating or feeling of fullness after a small meal, or what we call early satiety, can present with nausea and vomiting, weight loss, initially can have an ulcer or infection that can cause the same symptoms. So you see that these symptoms are nonspecific. So if you walk to a health facility and present with nausea, vomiting, probably the first chain of thought would not be stomach cancer, would think food poisoning. So some of the risk factors we mentioned about family history. We've talked about conditions where one is predisposed to chronic inflammation of the stomach, things like pernicious anemia, smoking, H. pylori infection, inactivity or obesity, and some of the general symptoms it presents with, like nausea, vomiting, discomfort, heartburn, loss of appetite, feeling of fullness, vomiting, which can be vomiting blood, and also weight loss. So for a diagnosis of stomach cancer, usually we ask about a family history of stomach cancer, physical examination, which is done by the doctor. I don't know how many of us have gotten an opportunity to see a gastroenterologist, or where they presented with things like heartburn, bloating, early satiety, and they had to undergo endoscopy to assess the stomach, look for any abnormalities. There are some other modalities that can be used, such as X-rays. And the thing about endoscopy, when the doctor is going in, they usually take a small piece or a biopsy, so that when any abnormality is noted, it can be taken for pathology to check for any features of cancer. Just as a by the way, treatment of stomach cancer can also include surgery, which can be partial or total gastrectomy, radiation, or chemotherapy. So on colon cancer, so there are certain risk factors for colon cancer. There are those conditions which predispose people to colon cancer. We have what we call familial adenomatous polyposis and HNPCC, where there are people who have this gene that predisposes them to colon cancer. If there's a family history of colon cancer in the family, previous cancer diagnosis can be ovarian, breast, age above 50, inflammatory conditions of the bowel, poor diet, and especially decreased fiber. The good thing about fiber is it helps us to have regular bowel movements. So sometimes the food we eat has a lot of chemicals or toxins that can be cancerous. So when you eat fiber, it reduces the contact time between our gut and these injurious agents, thereby reducing our risk of colon cancer. Smoking, certain infections. Sigmoidoscopy per se does not predispose to colon cancer, but it is done as a screening for colon cancer. I've mentioned investigations that can be done, such as colonoscopy. It basically means a scope of the colon, to have a look at the colon, a camera, to assess for any abnormal lesions in the colon. As part of the wellness checkups I've been able to attend, stool examination has been one of the checkups. And the stool examination, we call it fecal occult blood test, or FOBT. We're looking for presence of blood in stool that is not visible to the naked eye. And if we get the occult blood test turns positive, and when we do blood works, we find features of low hemoglobin or anemia. And on further history, we also get change in bowel habits, like in between episodes of constipation and diarrhea. Then we refer to the gastroenterologist for colonoscopy. In cases where there is colon cancer and it has spread, and you want to check where it has spread to, chest X-ray can be done, abdominal CT, in cases where we suspect metastasis or spread of the cancer. Other things we do is full blood count, liver and kidney function tests, among the tests that are done. So the thing about colon cancer, it's usually asymptomatic, and sometimes, and that is why screening comes in. Sometimes by the time cancer is presenting, or where we have symptoms, it has already spread to other areas. But some of the features of colon cancer can be passing fresh blood in stool or blood-stained stools, what we call hematochezia or melena stools, abdominal pain. I've mentioned about change in bowel habits, where we alternate between constipation and diarrhea, weakness, and anemia from the blood loss, weight loss, sometimes a palpable mass or obstruction. And colon cancer can spread to other adjacent organs, most commonly the lung and liver, rarely bone and brain, but it can also move to the pelvic area, where we have the ovaries, the uterus, and other organs. So, as a by the way, again, treatment includes things like surgery, radio, and chemotherapy. So, universal message for prevention of cancers are things that we can opt to do every day, or we can purpose to do every day. Maintaining a healthy diet, including a diet full of fruits and vegetables. I know we are going into the festive season, but some things we have to purpose to do. Exercise most days of the week. The recommendation is 30 minutes a day, 5 days in a week. But I find when you tell clients that, it gives them a lot of options. Should I work out today and do 1 hour and not tomorrow? Can I skip the whole week and do 150 minutes a week, a day? So I try to encourage people to make it a daily habit. If you can do 30 minutes today, tomorrow do 40, the next day continue pushing yourself. as you build tolerance, of course, starting slow and building up as one gains tolerance, and maintaining a healthy weight. So to sum up our topic on cancer prevention, so don't use tobacco, alcohol, eat, maintaining a healthy diet, maintaining a healthy weight and being physically active. And also probably to mention on maintaining a healthy weight, one of the ways we can assess healthy weight is by doing body mass index or BMI, or doing body composition, which has a slight edge over BMI because it's able to tell you how much of your body weight is fat, how much is muscle, how much is bone. Protect yourself from the sun. This is more about melanomas, but we didn't get to touch on that. Get vaccinated. It can be HPV vaccine. Hepatitis B vaccine is also available. Important in prevention of liver cancer, which is caused by hepatitis B and C vaccine. Avoiding risky behaviors. And of course, last but not least, getting regular medical checkups. Thank you. I think any questions or clarifications at this point?
Thank you so much for this informative. I mean, I learned so much out of your presentation, and I had few questions, observation, and comments. Doctor, you gave us a full example on how it starts. You explain us various kinds of cancer, from the male part, the female part of it. You actually also told us the preventative part of it, including the healthy diet. You also mentioned about the physical exercise that we require. Definitely, you also spoke about alcohol. I just want to for the viewers, in our faith, I mean, alcohol itself is prohibited. So basically, there is nothing that supersedes that. That's the law. Doctor, you also mentioned about smoking. I just want to, for the sake of our viewers, currently we have smoking, and now the fast emerging is vaping. Is vaping also part of it?
Yes, I should probably have said all kinds of smoking, vaping, shisha, all of them.
Great. Doctor, from your introduction, you also emphasize about the screening part. I was taking a few notes, and you mentioned about the screening, and you emphasized on that. When should we screen? Should we wait until the symptoms comes, or should we have a regular check? Example, you explicitly explained us, like for the mammogram for the female side, that after 40 years they are supposed to have a mammogram. And then for lesser than that, due to various risks, we'll go for ultrasound. But then you also mention about a physical examination on how to be done. So it's very easy, and you recommended from the presentation that we can do once a month. Now the question is, not everyone is going to do that, but we mentioned so many kinds of cancers, and it is emerging and growing right now. So how do you comment about it? What should we adapt? How frequently should we do? Should we wait until symptoms comes? You mentioned few symptoms, but is there any habitual part of it that we need to characterize within ourselves to ensure that we do screening?
So screening is different for the different cancers. So when you're talking about monthly for the breast exam, it's the self-breast examination, which any lady can do at any point. It takes very few minutes. I probably should also have mentioned the technique can be from in, out, in circular motion, or up, down, which can be done monthly. Your clinical breast examination, even if you request your healthcare provider during your routine clinical visit to do for you, it can be done. But for the ultrasound for the ladies 25 to 39, 39 years and below, it can be done yearly for the ultrasound, 1 to 3 yearly. But from 40 and above, we can do the mammogram every 2 years. Of course, supplementing it with the self-breast examination. For prostate, I've mentioned it is not routinely done to avoid overdiagnosis. But for male above 40 years, it is done every year because it is a blood test for PSA. Cervical cancer, because of having people engaging in sexual intercourse from a young age, guidelines recommend screening from 25 years. And how that will go on depends on the reports. So if maybe one goes for screening, pap smear this year, next year, and they're both normal, then the next screening can be done in 3 years. But if there are any abnormal changes that are seen during the initial screening for pap smear, then based on what is discovered, they have HSIL, LSIL, then the gynecologist will able to follow up on that, maybe on a colposcopy and so on. I hope I've been able to answer the question.
Yes, doctor, I have list of questions. Doctor, you for one, just you spoke about the pap smear part of it, but I understand also there is another way of doing it through iodine or something like that one. Is it more effective also?
So the recommended is the HPV DNA, where we screen for the HPV DNA virus. It might be a bit costly, and it's not available in all health facilities. And due to this limitation in resources, then we have other options of now the pap smear, where we look for any abnormal changes in the cervix, or what we call via villa. You see, one can have the virus and has not started having any abnormal changes in the cervix. So that is why the HPV DNA is superior, or is the recommended screening tool for cervical cancer.
Thank you, doctor. During your presentation, you actually gave out the statistics that how many lives are affected and you gave us statistics of year 2022, whereby you mentioned around we had more than 9 million deaths, and that is just due to cancer. Doctor, I just want to ask one thing. Does this cancer pass through a genetical part of it? Am I audible, doctor? Doctor, can you hear me?
Oh, no, I can hear you. I lost you for a moment there.
Okay, should I repeat the question?
Yes, please.
Doctor, you gave us the statistics, and I quote that more than 9 million deaths have been recorded due to cancer, and the statistics refer to year 2022. My question is, a person with family history of cancer, does it mean that the entire family or the coming generation will have? Does it pass through the genetics part of it?
So there is family history part and there is genetics. So an individual can have the gene and that predisposes them to a specific cancer, and other members don't have that specific gene. But of course, in a family where you have a history of cancer, then the risk of developing cancer is higher. But I mentioned that these risk factors tend to happen in groups. Not one necessarily risk factor can cause an individual to develop whatever kind of cancer. For example, maybe an individual who has the gene that predisposes to breast cancer is exposed to radiation, is a smoker or consumes alcohol, and is obese. So you see, we have these other factors that promote this gene that causes cancer, or rather promotes or increases the risk of development of cancer. So many risk factors usually become involved before development of the cancer. So it is not that guarantee that if there is one risk factor, then it's a definite that one will develop cancer.
Doctor, do you suggest those with family history should go frequent and recommended screening?
Yes.
Thank you.
And especially
Doctor,
with first degree relatives, I recommend regular screening.
thank you so much. And I'm sure the viewers also are taking note that those with family history, the emphasis has been made that they should go for regular screening. Doctor, we have one question from one of the viewers, and it says, is a male of 65 years of age, and he says in the morning urine takes time to pass and stops. He has to wait for a bit for it to flow again.
So thank you for the question. So based on the age and the symptoms, I do recommend further checkup. Of course, more history is necessary, but you also need to consider other things like benign prostatic enlargement, which presents with these symptoms of taking time to pass urine or straining, or stopping midstream, or what we call hesitancy. So it does necessitate, based on the age and symptoms, further investigations to assess the cause of these symptoms.
Doctor, currently we see there is at times I just read on those packages that come out from the health facilities. It speaks about urine flow meter, something like that. Would it help somewhere in such case, similar case?
So yes, normally, okay, let me not say normally because I'm male, but what from studies or what we've learned is that when one is passing urine, it's able to jump a certain distance, maybe a meter or so. But when there is obstruction to the flow of urine, that distance is not there. Urine tends to dribble, or it can maybe flow maybe on the foot, or rather land on the foot, or just nearby, maybe in the bowl of the sink, depending on how it's standing. But there is that distance that ideally, where there is normal urine flow, urine should be able to land.
Thank you so much, Doctor, for the clarity. Doctor, when we come to you spoke about cervical cancer also, and you said the cause is HPV virus. Doctor, is there any blood test to be done for that one, or it just needs to do through a pap smear? Because I thought maybe probably just as a layman.
So when we're doing blood tests for cervical cancer, maybe when we want to assess the cancer has already been diagnosed and it has spread and we want to assess other organs. But we don't routinely do blood tests to screen for cervical cancer. It's either the HPV DNA or pap smear or via villi in resource limited centers, but we don't routinely do as a screening for cervical cancer. I don't know if the ladies who've gone for the pap smear, it is, from experience, I've had ladies say it is uncomfortable and they wouldn't want to do it again. But it is necessary, and maybe the initial experience was bad, but that should not deter ladies from going for cervical cancer screening, because it is preventable and very treatable, especially when it is caught early.
Thank you, Doctor. Doctor, in one of the categories that you were explaining us about the stomach cancer, you mentioned one of the root cause can be H. pylori.
Yes.
Can you just, because I've learned something about H. pylori, and it's mostly common bacterial, I guess, disease that is mostly in our continent. Maybe if you can just highlight on H. pylori, and of course the statistic is that many of us that they've either got infected, few of them have not got infected, and just to give them a highlight so that we can also sum up and connect it, because it's one of the root cause for the stomach cancer.
So yes, H. pylori is quite common among us, and especially since one of its mode of transmission is fecal-oral, when we don't observe hand hygiene or food hygiene. So if left untreated, so it affects the stomach. Let's start from there. And if it is left untreated, it can cause an ulcer. And if this ulcer, with this ulcer, we have a chronic inflammation. And with this, there happen to be changes in the stomach that can cause changes from the normal stomach tissue to development of changes that can be abnormal, in the sense that they can even turn cancerous. So that's why when we get people presenting with symptoms of dyspepsia like bloating or early satiety, one of the things we want to screen for is H. pylori, because it is easily treatable as well with antibiotics. And maybe also on the topic of antibiotics, it is to discourage people from taking antibiotics over the counter without the doctor's prescription, because they're also having cases of H. pylori infection that is antibiotic resistance, and so the necessitating need to use even stronger antibiotics.
Thank you, Doctor. And just for the viewer's sake, I mean, you spoke about this H. pylori, and you also acknowledge that it's widely, mostly our members within the continent, they get this kind of things. So I'll also suggest and recommend and emphasize that our members should also do a regular checkup also for similar things like H. pylori. You know, a stitch in time saves 9. The moment we don't do it, actually goes up and gives us another issue. Doctor, while I'm receiving few questions from our viewers who are watching online, and I would like to read this. One of the members have written. One of the viewers has written. I'm just struggling. Yes, he said, given the family history, screening is recommended for other family members. Which types of tests are most appropriate for detecting and diagnosing cancer?
So there are different ways of screening the different cancers. So it depends on the specific cancer that is in the family. So for example, if it's breast cancer, we recommend screening, of course, considering the age. I mentioned that maybe ladies who are 40 years and below, but they have a family history of breast cancer, and they're presenting to a facility or to the healthcare provider with abnormal breast changes that could suggest breast cancer, then we still do a mammogram. So things like ovarian cancer, because there's also risk of conditions like colon cancer, we can screen for both. I mentioned for colon, we do a simple stool test called the fecal occult blood test. That together with the colonoscopy that is done by the gastroenterologist. So other cancers may not be routinely screened. So things like maybe lung cancer until someone is presenting with the abnormal symptoms. So it depends on the specific cancer that one is worried about, or the specific cancer that is in the family. So, so that's what guides the screening.
To what I understand, probably the spirit of this question was: is there any single test that shows yes there is a cancer or something like that? With all the advancement of technology, probably that's the spirit I believe. But I understand that you have specified with the type of cancer that is running through that family. That's the place where we need to do the testing, isn't it?
Yes, so there's no one specific test that
Correct.
we can use to screen for all cancers.
Correct. Doctor, for the breast cancer, we mentioned about the physical, which is easy, cheaper, affordable. Just awareness is required, and thereafter there is a time that we need to do the mammogram of it. Is there any
Yes.
cheaper test for that, like any kit for that, to make it affordable, or mammogram is the option along with ultrasound?
So mammogram and ultrasound are the current screening modalities. They are not, I would not say they are expensive. I think they are relatively affordable. And considering the risks and benefits, I think we can afford to do screening for breast cancer. I'm not sure, maybe the representative from Zamara can tell us if insurance covers for screening for breast cancer, maybe mammogram or the ultrasound, but they're relatively affordable imaging modalities.
We'll wait for Hilda to answer that part.
Yes.
So, Doctor, while most of the questions have been answered, what is your advice to those people who smoke? In entire presentation, you actually said about the smoking part and all those things, and definitely currently the trend is coming on vaping. What is your advice to those who smoke, vape, shisha?
So my advice, so to those who are not smoking, I would say don't start, because I have seen people having a difficult time trying to stop because of the nicotine part of it that is quite addictive. And to those who are smoking, I would advise to stop. based on the very many different medical conditions that are associated with smoking. We've only mentioned cancer and heart disease or stroke, but there are many other conditions. It causes atherosclerosis. It causes poor wound healing because it damages the blood vessels. There are very many things associated with smoking. So my advice would be to stop. And there are different, or there are people who offer help to people who are trying to quit smoking. So there is help available to anyone who would wish to stop.
I see Hilda is here. Probably she can answer the comment that was raised by Dr.
Thank you, Mr. Aliraza. Thank you, Doctor. So in regards to screening, yes, insurance covers usually cover screening of the various cancers. Actually, most insurance packages will offer like a full medical checkup package. Usually, the medical checkup package will also be inclusive of the cancer screening packages. So if one is in a position to, we'll encourage as you utilize your annual cover, you could also request screening of cancer. And also most, especially in this month before October ends, most medical institutions are currently being a Cancer Awareness Month. Most medical institutions will offer the screening services at subsidized prices. So you can also take advantage. We have a whole, I think, 13 to 14 days before close of October. So if you're in a position to kindly take advantage of the offers that are usually offered by most medical institutions to get the screening done for you. Thank you. Back to you, Doctor.
Yes, thank you. It is true. Quite a number of facilities are now offering, especially this month of October, screening for breast cancer at very subsidized prices. So now that we have the knowledge, we know how to prevent it, to prevent cancer, and we've talked about screening, there is nothing holding us back to go for screening. We should all take it up. We've said part of awareness is to reduce stigma. So we should all go for screening.
Thank you, Doctor. And this is where I agree completely with you that we need to break the stigma. I recall there was a time that a person with cancer, a person would not also shake hands with them on that thought process that it is transferable. But right now, with all those things, I don't know if you have counted similar kind of instances.
Yes, I have. Part of my undergraduate I did in Kenyatta, and some of the clients I interacted with were being told that they got cancer because of witchcraft or part of karma because they did wrong to someone. So it's what we are trying to, that thought process is what we are trying to avoid.
Right. So, yes. Doctor, I've completed most of the questions, and it has been addressed, and it was a very wonderful session that we got and insightful. I must thank you for taking us with all the visuals that you showed. You gave us the symptoms, the root cause, and also the guidance. Mostly the emphasis was on screening and awareness part of it. And I won't do justice if I don't appreciate also Hilda. She's the one, she organized this one through Zamara. They've been assisting, they've actually assisted us when we discussed and they arranged this part. And I believe we had planned this session and it started on time. Probably we due to the questions that are arising, a lot of questions will also come, and we'll reach out to Hilda to ensure that that these questions are being answered. also to break the stigma. And we have a slogan that we created. We have our campaign that has been going on for whole this month, and it says, and I wish to just to reiterate what we are saying on the we are saying: protect her, check earlier, and live fully. CHB early detection saves lives, and it's actually complementing on what you are saying. So we actually thank you. We thank Hilda for organizing through Zamara, and probably we'll actually need more of those medical webinars whereby our members actually can ask questions. Many of them, they have questions, and such program actually are very informative.
So thank you so much, and thank you for attending. Looking forward to more discussions.
Thank you so much. You have invited. I can assure you that a lot of list will come to you.
Okay, I'm looking forward to it.
Definitely. So
Okay.
for the viewers who are looking, we have Hilda here. In fact, she's our account manager for FED Life. Probably she has some remarks to speak. She's the one we reached out to her, and she organized this session for us. So I'll actually hand it over to Hilda to speak some closing remarks.
All right. Thank you, Mr. Aliraza, and thank you, members, for attending the session. We believe it's been an interactive session, and we've all learned. Actually, I've also had quite some information that I didn't know before. It was quite informative. And it's our pleasure as Zamara to add value to our clients through such sessions, not just to handle the claims and just do what's on the books. It's usually a pleasure for us also to add values to our clients through such sessions, and we look forward to further sessions. And thank you, Dr. Stephanie, for this session. It was very informative, and we appreciate the partnership, and also appreciate the partnership with the Africa Federation, and look forward to very many more of such sessions. And we are open to any questions. You can reach through Mr. Aliraza, and we will also reach out to the doctor, who is our partner. And any questions, or anyone who wants maybe on a personalized session with the doctor, just to maybe ask something that they may feel will need clarifications, we are here to assist in whatever ways. And we do not take your partnership for granted. We really appreciate your partnership. And thank you so much for trusting us with your life cover. Thank you.
Thank you so much. Thank you, doctor. Thank you, our relationship manager, the risk consultant, and of course, the viewers. Finally, the closing remarks from CHB: early detection saves lives. Make sure you screen regularly. Your health is your wealth. Thank you very much, and have a good night.
Thank you. Good night.
Thank you.
Thank you. Good night.